Do you know over 1.5 million Americans are diagnosed with diabetes every year? What's more shocking is the majority of them don't even realize it unless they get into severe health complications, such as type 2 diabetes. That means there might be a possible chance of you being pre-diabetic. That's what we will figure out in today's video by discussing the top 8 warning signs of a pre-diabetic person. Let's get into it one by one. Number 1. Frequent urination. One of the most common signs of prediabetes is the frequent urge to urinate. When your blood sugar level is higher than normal, it can lead to more urination than often. This is because when excess glucose is present in the blood, the kidneys work harder to filter and absorb the excess glucose. When they can't keep up, the excess glucose is excreted into the urine, drawing water along with it, which increases urine production. Generally, a urine frequency of 4 to 5 is considered ideal for a healthy body. If you're experiencing more trips to the bathroom, it's a visible sign of prediabetes. If left unnoticed, it can lead to severe health disorders, often causing stroke or heart failure. Number 2. Blurred vision. Do you often struggle to distinguish two objects or cannot accurately see the fine details? If yes, it is a symptom that your vision has become less precise, leading to temporary vision changes. This ocular sign, generally known as blurred vision, is strongly associated with prediabetes and is a common complaint of diabetic patients. You might wonder how prediabetes can cause vision changes. Well, the answer is quite simple. When your blood sugar levels are high, glucose enters the lens of the eyeball and changes its shape and refraction. These changes in glucose cause swelling of the lens, and you fail to focus on two closely spaced objects. The excess sugar causes accumulation in the bloodstream and affects the focusing power of the eye. This way, you feel blurred vision or changes in your eyesight. Hence, the next time you struggle with your eye, make sure to consult an eye professional, as if left untreated, it can lead to severe type 2 diabetes. Check your blood sugar levels regularly and stabilize your glucose spike to go back to normal vision. Number 3. Increased thirst. The urge to drink water can sometimes be a dangerous warning sign of prediabetes. When your blood sugar levels are high, your kidneys filter more glucose and excess water is passed out in the form of urine. Due to this reason, you feel thirsty even if you have consumed water a minute ago. This increased thirst can also increase your visits to the bathroom, causing frequent urination, especially at night. Many people ignore this sign of thirst and continue with sugary drinks or beverages. Medically, this symptom is highly dangerous and is called polydipsia, in which glucose is not reabsorbed, causing an abnormal urge to drink fluids all the time. When blood glucose levels exceed the kidney's ability to reabsorb glucose, the excess glucose is excreted in the urine. This process is known as osmotic diuresis. Glucose draws water with it into the urine, increasing urine output, and the vicious cycle continues. As the person drinks more to quench their thirst, the fluid intake helps to alleviate dehydration temporarily. However, if blood sugar levels remain high, the cycle of increased glucose in the urine, frequent urination, and resulting thirst continues. Number 4. Fatigue. When your blood sugar levels fluctuate, you feel persistent tiredness or out of the energy zone. The feeling of lethargy or fatigue is a visible sign of prediabetes. In it, insulin resistance develops, meaning the body's cells become less responsive to insulin. Insulin is a hormone that helps glucose enter cells to be used for energy. When cells don't get enough glucose, they lack the fuel needed to function properly, leading to feelings of tiredness and fatigue. High blood sugar levels can affect the body in multiple ways. Excess glucose remains in the bloodstream rather than being used by the cells, which can lead to a constant state of low energy despite having an adequate intake of food. Elevated blood sugar levels can interfere with the absorption of nutrients from food. Over time, this can lead to deficiencies in essential vitamins and minerals. Thus, you feel a lack of energy and feel tired. Number 5. Frequent infections. Do you have infections or sores that take time to heal? These frequent infections are a clear sign of prediabetes. Let's see how this happens. High blood sugar levels can weaken the immune system, making it less effective at fighting off infections. This impairment occurs because hyperglycemia can affect the function of white blood cells, which are crucial for immune defense. Elevated blood sugar levels provide an ideal environment for bacteria and fungi to thrive. Many pathogens feed on glucose, so higher levels in the blood and tissues can promote their growth and multiplication. Prediabetes often comes with circulatory issues. Poor blood flow can reduce the delivery of oxygen and nutrients to tissues, slowing down the healing process and making it easier for infections to take hold and spread. Number 6. Unexplained weight loss. Usually, weight loss is satisfactory, but an unexplained decrease in weight can be a drastic sign of prediabetes. Despite eating normally, the body may start to break down muscle and fat for energy due to an inability to utilize glucose properly. Because cells are not getting enough glucose to use as fuel, the body starts to look for alternative energy sources. It begins to break down fat and muscle tissue to meet its energy needs. Thus, you feel a loss in muscle mass, leading to weight loss. Share in the comments if you have also experienced an unexplained or sudden weight loss in recent days. Number 7. Increased hunger. Do you often feel hungry even after eating a lot of food? That's a visible sign you're a victim of prediabetes. This feeling of increased hunger, also called polyphagia, can occur through various mechanisms. In prediabetes, the body's cells become resistant to insulin, the hormone responsible for allowing glucose sugar to enter cells and be used for energy. When cells don't respond properly to insulin, glucose cannot efficiently enter the cells. As a result, the cells are starved of energy despite high levels of glucose in the bloodstream. Although blood sugar levels are elevated in prediabetes, the glucose is not effectively utilized by the cells for energy due to insulin resistance. This lack of energy availability triggers the brain to signal hunger, as it perceives that the body needs more fuel, even though there is already plenty of glucose present. Moreover, high blood sugar levels can cause increase in ghrelin, which is a hormone that stimulates appetite. This increase in ghrelin can lead to enhanced feelings of hunger and put you closer to prediabetes. Number 8. Dark skin patches. Prediabetes is often associated with dark, velvety patches in body folds such as the neck, armpits, and groin. The excess insulin in the bloodstream can trigger the skin cells to reproduce at a faster rate. This increased cell production particularly affects areas where the skin folds, such as the neck, armpits, and groin. The new skin cells have more melanin, the pigment that gives skin its color, which leads to the formation of dark, thickened patches of skin. This condition is called acanthosis nigricans. Insulin can also act as a growth factor for skin cells. High levels of insulin can stimulate the growth of skin cells and increase keratin production, leading to the characteristic velvety texture and hyperpigmentation seen in acanthosis nigricans. Therefore, the next time you observe these dark patches, consult a healthcare expert, or else you'll end up in the last stage of diabetes. As we wrap up the video, ensure you follow a healthy lifestyle and immediately seek medical help to avoid prediabetes. If you experience any of the signs mentioned above, do not ignore them, as they are the initial step pushing you towards a deathbed. Follow a healthy diet and include physical activity to maintain normal sugar levels. For more health insights, like this video and subscribe to the channel.